Hi guys, Dr. Minkoff here. I had a wild case this week and I want to relate it to you because it's just another one of those, holy smokes, we really got it. The story is this: a 20-year-old female with a history of 3 years of having 5 to 8 seizures every day was brought to the clinic. It turns out that her parents are missionaries over in Indonesia, which is where they live, and that's where she lives. About 3 years ago, she started to have seizures, and she started having distress with her stomach and nausea. And over the last year, it's gotten worse and worse and worse. And because she wasn't able to eat, and because of the chronic seizures, she went from 120 pounds down to 89 pounds. She was very weak, she was very frail, and she would have episodes during the day where she felt like very great amounts of fear, where she was almost uncontrollable, and they didn't know what to do with her. They took her to some practitioners there. The parents are very sort of holistically oriented. They didn't want to put her on seizure medication. She'd had brain scans and brain MRIs, and nobody had been able to make a diagnosis on her. So I had seen some of the other family members that live in the United States, and they had been doing well, so they referred her to here. And so when I saw her, she's a frail little thing, very weak, 89 pounds. Pale, and again, 5 to 8 times a day having seizures. When I first examined her, what I found was that the most disturbing thing affecting her autonomic nervous system was something that we call jaw osteitis. It means inflammation or infection of the jawbone. And I detect this using a kind of examination. It's a kind of body biofeedback examination called autonomic response testing. So with this technique as a part of my physical exam, I can pinpoint what is the major stressor going on in a person's body. And on hers, it turned out that it was what was called jaw osteitis. Now, when I get this response, what I did was I sent her to my local biological natural dentist, and he has a very sophisticated CAT scanner in his office where he can do what's called a cone beam CT. It's a CT scan of just the teeth. And when I sent him over there, what he said is it looked like at 2 wisdom tooth sites, number 17 and 32, that there was what's called a cavitation. The density of the jawbone in those areas showed that the bone had never healed in once the tooth was removed. And there was actually a cavity there. Now when this happens, many times that cavity will fill up with infection or toxins, and it can influence the nerve that goes through there, which then can influence the brain. So he decided to do an operation on her where he could take off and open up this cavitation. He found, by the way, that the symptoms started only 6 or 8 months after she'd had her wisdom teeth pulled. So the symptoms kind of correlated time-wise with what was going on. Prior to that, she'd been normal. When he unroofed that part of the jawbone where the wisdom teeth were on number 17 and 32, these are the 2 lower wisdom teeth, he found big holes in there with some gooey, green, yellow material that was odorous. And he cleaned it out. And then what he did is he took some of her blood, spun it down, took the stem cells, washed out that whole area with ozonated water to clean it up, put the stem cells in there, and then closed the hole. From the point of the surgery for 1 week, she had no seizures. First time in 3 years. She gained 2 pounds because she started to eat. After 1 week, she had a seizure. I sent her back to him. He injected ozone in both sites again, irrigated it with ozonated water. I saw her 3 weeks later. She's had no seizures. She's gained 2 more pounds. She feels fine. She's going to be going back to Indonesia in the next week. She's completely fine. Now this is really, really important that people know this, because without this treatment, she would be on chronic seizure medications. Maybe or maybe not this would work or not, but it isn't what's wrong with her. So you have a normal 20-year-old, no head trauma, normal brain, EEG shows petit mal seizures, but she's got a reason for her seizures. And when you go to the doctor, you want to find a doctor who's looking for reasons for problems. And when you get the right reasons, the problems resolve. And so that's what good doctors do. They don't cover up symptoms with medications. Sometimes medications may be needed to alleviate a problem for a while, but if you then find what the reason is, then the symptom goes away, and the person is then fine, like she is. And she's going to go home and be fine, and she's going to gain her normal weight back, and she's going to be totally okay. Now, couple of points. If you go to a dentist to have your wisdom teeth pulled, or any tooth pulled, this is a really important point to make with your dentist, because usually when dentists pull teeth, they just pull the teeth. The anatomy of the tooth, if this is the tooth, and this is the jawbone, the tooth sits in a sling. That sling is called the periodontal ligament. And the tooth isn't fixed hard to the bone. It's in the sling because if you bite something hard, the tooth has to be able to move a little bit or it would break. This is why you can do orthodontics, and in a matter of months you can move teeth around, because they're not fixed in the bone. They're in this ligament and they can wiggle and they can move back and forth a little bit. If the dentist just pulls the tooth and the periodontal ligament is left in there, so now here you have the tooth is gone and you have the sling and he sews this closed, the periodontal ligament is there, this can be used as a collection spot for the body. Bacteria can get in there, infection can grow in there, the body doesn't handle it, and you get what's called a cavitation or jaw osteitis, and this is a real thing. And the most common teeth that are pulled are wisdom teeth. The wisdom teeth, in terms of Chinese medicine, relate to the brain, to the heart, and to the small intestine. I have seen earlier patients where they had cavitations in their wisdom teeth and they were having heart irregularities. They were having atrial fibrillation. They were having PVCs. And when we handled the cavitation, their heart resolved, because this pathway through the wisdom teeth goes to the heart and goes to the small intestine and goes to the brain. In this case, she had a brain problem. It was seizures. So, what you want to tell your dentist to do if you have a tooth that needs to be pulled is they have to take out the periodontal ligament when they pull the tooth. Really important. An oral surgeon will always do this because they know. But a lot of general dentists don't know it, they don't do it, and that's what happened with her. It was sitting in there, and then she got this chronic infection in 2 places. So if you need a tooth pulled, you want to discuss this with your dentist first, so they make sure they do it. And if the guy's really good, he'll put the stem cells, the PRP, the platelet-rich plasma, they'll draw some blood from you, they'll spin it down, they'll take the platelet-rich plasma, they'll put it in there, then they'll close it. These stem cells cause bone to grow in there so it's nice and dense. The finding on her CT scan was there was no dense bone there. That's how we knew there was a problem, other than on the autonomic response testing, which showed it to me. But I couldn't look in there and see anything because you can't see it. And I saw the dentist at first, before he did the CT scan, did a regular Panorex x-ray. You can't see it. You have to do the CT scan. So if you're getting teeth pulled, make sure they're pulled the right way. If you have chronic problems with your heart or your small intestine, or you have central nervous system problems, it might be that you have a cavitation. And that cavitation can be handled by a knowledgeable biological dentist to the point where it might resolve your problem, as it did with this young woman. Okay? So points to leave you with: Dentistry affects health in a big way. We don't want materials in the mouth that aren't good materials. We want to make sure that procedures that are done in the mouth are going to be compatible with the rest of the body. And if we do that, we can have nice teeth that are functional, and we won't have downstream problems from the dentistry. Okay? Hope this helps.